Nursing Plan of Care. Nursing plans of care are located in the Orders tab under the Nursing section. The suggested plan of care will be populated based from documentation and orders. So these plans of care are going to be located underneath the suggested plan section. So example, if I placed an order for restraints, the suggested plan of care for restraints are going to fire to that suggested section. On admission, any choices made in the nursing diagnosis field will suggest the appropriate plan of care. On admission, plans of care should be accepted or added within 4 hours. The following video will walk through this process. On admission, you need to go to your suggested plan section. Okay, my patient has these suggested plans based off of documentation and orders. So I need to go through each suggested plan and determine if it's appropriate for my patient. So I'm going to go to the alteration in comfort, and my patient has been in pain, so I'm going to go ahead and accept this plan of care. Okay, then I'm going to go through and look at every goal and see if there's some additional goals that I need to use for this patient, and then I'm going to go through my interventions as well. Once I have everything listed there, I can sign it off. I can go through multiple care plans at a time, so that's what I'm going to do before signing off. So next I'm going to go to my alteration in respiratory. Again, if this is something that is appropriate for your patient, you can click on accept. Check mark any additional goals and any additional interventions. If I have a plan of care that is here that is not appropriate for my patient, then I want to go ahead and reject it so that way I can get rid of it for this patient. Okay, once I've gone through everything, I can click on sign, and then it's going to tell me to refresh. And so now I can see the plan of cares that I've added on admission. If your plan of care was not listed there, you can go ahead and click on the Add button, go to your Nursing IPOC folder, and let's say my patient is at risk for infection. So I can simply click on Risk for Infection, fill in any additional goals and any additional interventions that I might need, and then I can sign that off. The next thing that you want to do when you get a new patient and you're admitting them is to go to each plan of care. So to do that, we go to our Document and Plan tab, and we need to document the status. So we need to state whether this is an actual or potential problem. So I'm going to state that this is a potential problem. Okay, then I'm going to go to my next plan of care and document that it's an actual problem. And then my last one. So once you have added all your plan of cares, gone into your Document and Plan tab and documented the status, you've completed the plan of care process for admissions. The plan of care should be reviewed every shift with changes in patient condition upon transfer and post-procedure. The plan of care should be evaluated by an RN every 72 hours or every Sunday for the NICU. The following video will walk through the process of reviewing a plan of care. When reviewing your plan of cares every shift, you're going to go into the Document and Plan tab, and you're going to go to each plan of care and click on the plan of care reviewed. So by reviewing this, I'm saying my patient is still at risk for infections, so I'm going to document that I'm continuing this plan of care. Okay, and there's no need for me to come in here and document on every single goal and every single intervention because I'm going to continue to do these throughout my shift. So all I'm going to do is document that I am continuing the plan of care. So next I'm going to go to my comfort one. So again, I'm going to go to my plan of care reviewed and I'm stating that I am continuing it. Okay, and the same thing with my respiratory status. So I'm still continuing this plan of care because it is still appropriate for this patient. Again, there is no need for me to come in here and document on every single line item. That takes too much time, and by coming in here and saying that I'm continuing it, I'm saying that I'm doing all of these things already. So save yourself some additional documentation. Okay, the same exact thing goes when you're evaluating the plan of care. So when I come click on the evaluation, I either document continue, revise, or resolve. Okay, so here I'm going to say I'm continuing it. Same thing with your evaluation. By saying you're continuing it, you're saying you're already doing all of these things. So there's no need to go to every single line item and document on that. When a patient is transferred, the receiving nurse will review the plan of care and make changes as needed, whether that indicates they need to resolve the plan of care, discontinue the plan of care, or add plans of care as needed. The following video is going to walk through the process of transfers. When a patient is transferred, the receiving nurse is going to go through the plans of care, determine if they're still appropriate for the patient, and document. So to do that, we're going to go to our Document and Plan tab. We're going to come to our first plan of care, and I've decided that this is still an appropriate plan of care for the patient. So I'm going to click on the Risk for Infection plan of care, and I'm going to document that we're still going to continue this plan of care for this patient. Okay, then I'm going to go to the next one, and it's an alteration in comfort. I still agree with this plan of care for the patient, so I'm going to come to the plan of care reviewed and documenting that we are still continuing it for this patient. Okay, the next one is our alteration in respiratory status. So I don't feel that this patient still needs this plan of care. I feel that this has been resolved. So when you are resolving a plan of care, this is the one time where you do need to go and document on every single line item. Okay, so I'm going to go to my top goal and state that this was met. By clicking on this check mark, it'll easily document that the goal was met. Okay, they're maintaining adequate gas exchange. Okay, the alteration in respiratory status plan of care reviewed. We're saying that it's been resolved. Okay, so we're going to go through each and every single line item when we are resolving a plan of care. Okay, by clicking on the check mark, I'm stating that everything is met and that everything is done for the patient. If you clicked on the check mark on accident, you do have this little eraser icon that will erase that documentation. Okay, so now I've gone through and I've addressed everything and I've stated that this plan of care is now resolved. So now I'm going to sign off my documentation. Okay, notice how every line item has been addressed for this patient, but we're not done yet. Okay, since our patient is still here in the hospital, we need to discontinue that plan of care. So we're going to go to the Orders tab and go to our Respiratory plan of care, and we're going to right click and choose the option of Discontinue. Okay, up here at the top, there is an option of Plan of Care Resolved, and then you're just going to click on OK. Notice it marks everything out, so we're going to sign it and refresh it. So I can still see that this is there, but I see that it says discontinued because it's no longer applicable for your patient. Again, as the transfer nurse, you can add plans of care as needed that are appropriate for the patient. But just remember to go through every single one, address them, continue them, resolve them, or get rid of them. When a patient has a change in condition or a procedure, the nurse should review the plan of care, make changes as needed, resolve anything that can be resolved, discontinue those plans of care as no longer needed, and add any additional ones needed for the patient. Example, your patient just experienced a seizure, which is a change in patient condition, so you need to add the potential for injury related to seizure IPOC for this patient. Another example would be you're sedating your patient for a procedure, so you need to make sure and add the alteration in LOC plan of care. When your patient is no longer at risk for alteration in LOC, the plan of care should be resolved and discontinued for the patient. If you want to view additional documentation, you can click on the black triangle in the Orders tab. This will expand the information so you can view the documentation on the plan of care. You can also view this documentation within the Document and Plan tab by clicking on the plus sign. It works the same way as the black triangle by expanding the information to allow you to view the documentation. Plans of care should be accepted or added within 4 hours of admission. Plans of care should be reviewed every shift and evaluated every 72 hours. Plans of care should be reviewed and updated upon transfer, and plans of care should be reviewed and updated with changes in patient's condition and with any procedure.